Becky Thompson. I've met a number of you, but not everybody. So nice to meet you to those I have not met yet. And so I'm going to be talking quickly, going to talk fast the lightning round about advocacy efforts that WAPA is engaging in. So WAPA is the Wisconsin Autism Providers Association. And so we're made up of about 11 different organizations that provide behavioral treatment to children with autism. And this is kind of a snapshot of the counties that we cover across the state. And a quick shout out to our members. So these are organizations who belong to WAPA. And we got together and were organized in 2017 due to increasing access issues, in particular for children who have Medicaid as their primary funding for behavioral treatment. We've seen over time from surveys that WAPA's conducted that waitlists are continuing to grow. And it's in particular growing for children who have Medicaid. Children who have commercial insurance like United Healthcare, Blue Cross Blue Shield, typically are able to get into treatment programs pretty quickly. But unfortunately, with the funding that's available for Medicaid and the amount of red tape, a number of providers won't take Medicaid clients at all. And so that's really put a lot of pressure on those of us who do try and serve all the children who need our help, of just not having enough staff to be able to take on all the children that need services. And as I think, I'm sure the audience is very aware of the importance of early intervention. That's what we're all here about, of Act Early. And we're literally racing the clock and losing a lot of valuable time with many providers having wait lists of more than 6 months, sometimes 9 or 12 months. Kids are waiting to get started. And while this treatment is helpful, at all ages across the lifespan, we really see those most drastic treatment improvements when we see kids in those preschool years. And so we're really sure that clock is ticking with these young ones, and we're trying to get them into treatment quickly so that they can really get the most out of treatment. So just to perspective of where things are with funding, this is for the 48 states that have Medicaid benefits in place for autism treatment, and Wisconsin is the red over here on the left. So we're definitely on the low end nationally as of last year, 2021. As of 2018, we were actually second from the bottom. So we've made improvements, moving from second to the bottom up to the red line there. And then I have some successes to share that we're continuing to move towards the middle as of January of this year. So we're just a month into more funding. And so we've been working hard since 2017 to try and advocate for increased funding to really help increase access to services for children with autism. We were able to get that increase from second to the bottom to a little bit to the right in 2018 with Governor Walker's administration. Then we worked through the 2019 budget cycle with Governor Evers and the Joint Finance Committee. Didn't quite make the mark there, got a lot of supportive feedback from the Joint Finance Committee, but we were not able to make it into that budget. They did suggest that we seek what's called a Legislative Study Council, which is a group that gets together and kind of does a deep dive into issues to see, well, what are the problems, what are the issues, and how can we help address those with solutions? That is probably gonna be a theme for this call. Then COVID happened. So then we weren't sure where that was gonna go, but we were very, very blessed to have virtual options. So we were one of 4 topics that were used, had a Legislative Council Symposia series virtually held. And so there was a 4-part presentation in September of 2020 on access to autism treatment services. And Senator Jacques has really been a great partner and champion in this process. He helped chair that symposia series and put forward a bill for trying to get increased funding for autism treatment, and made a budget request for the 2021 budget to get some increased funding. And so we did it all again in 2021, working towards that budget, worked again with Governor Evers' office, and we were able to get into his budget proposal, which was a great success. But if you may or may not know what the legislative process and our budget process, the governor proposes the budget, and then that goes over to our state legislature, who then decides what their budget's going to look like. Both houses approve it, and then it goes back to the governor. So at that point, our mission was to stay in the budget once it went over to the legislature. And that was a roller coaster experience in itself, but had a lot of great community support. And so the community was very responsive to some calls to action, and they contacted their legislators with emails, with phone calls, and really made it known that this is an important topic and an issue that does really need more support in the state of Wisconsin. And so we then were able to make it into the 2021 budget with a rate increase that just went into effect on January 1st of 2022. So we are making some progress. In addition to advocating for more funding, we also work closely with the Department of Health Services and the team members who oversee the behavior treatment benefit. And we have meetings with them along with a few other organizations twice a year. And in those stakeholder meetings, we're able to provide bi-directional feedback where the providers are really able to share with DHS how is the policy working in reality on the ground, trying to serve families, what are the hiccups or barriers that we're facing, and really kind of work together to try and solve issues as much as we can within the limits that they have to work within. Some real big successes that we've had is first in the emergency telehealth policy that went into effect when COVID started. DHS was very receptive to our feedback and input and made modifications to the policy to really help us do our best to support families virtually at the beginning of the pandemic. That policy continued in place through December, and now we just have our permanent policy for telehealth went into place in January. And again, DHS was very open to our feedback, and pretty much the policy looks exactly the same for behavioral treatment. And so it's been a really successful collaboration on that front. We've also been able to expand coverage of Medicaid funding for social skills for children with autism, and we've reduced some of the red tape that there is. There's still plenty of red tape to work on, but DHS has helped to cut back on some of that. So our next steps are continuing to partner with Governor Evers and Senator Jacques, trying to get additional funding that we're very pleased that we did get some recognition in January, but it was still short of what I think is going to be needed to really help address those access issues and get additional providers becoming Medicaid providers, and continuing to work with DHS on cutting the additional red tape and then trying to get reimbursement for all the services that we provide, because there are some services like supervision services that are really clinically necessary that we provide that commercial insurance covers, and at this point we aren't able to get reimbursed for through Medicaid. And that was it, lightning speed. So I'm happy to answer any questions.
Becky, I do have one question. When you mentioned the reimbursement for social skills, is that like within the context of like ABA therapy and those hours versus like a differentiated service that a child might seek out?
Correct. It'd be for group treatment of group behavioral treatment. Okay. Depending on the provider, if it was a mental health provider, like a psychologist or professional counselor, social worker, then you can bill group therapy under mental health codes as another option.
Got it. And I was going to put in the chat that I learn so much every time you come and share updates with us. So instead, I will just tell you, and thank you for that.
Well, thank you so much.